Okay, now as I mentioned earlier, an agonist binds to a receptor and produces a biological response based on the concentration of that agonist and the fraction of activated receptors. Now, the intrinsic activity, like I told you earlier, of a drug determines its ability to fully or partially activate the receptors. Now, drugs may be categorized according to their intrinsic activity and their resulting Emax values. So if we characterize the agonists, we have basically three types. First of all, we have the full agonists. Now, in this, if a drug binds to a receptor and produces a maximal biological response that mimics the response to the endogenous ligand, so this is called the full agonist, right? And full agonists bind to a receptor. It stabilizes the receptor in its active state. And these are said to have an intrinsic value of 1, because this is what we'll compare the rest of the intrinsic values to, basically. So at all full agonists for a receptor population should produce the same Emax. For example, phenylephrine is a full agonist at alpha-1 adrenoceptors because it produces the same Emax as does the endogenous ligand, which is the norepinephrine. Now, upon binding to the alpha-1 adrenoceptors on vascular smooth muscles, the phenylephrine stabilizes the receptor in its active state. This leads to the mobilization of intracellular calcium, causing interaction of the actin and myosin filaments and shortening of the muscle cells, and in short, a response is produced. And the diameter of the atriole decreases, causing an increase in the resistance to blood flow through the vessels, an increase in blood pressure, and you know the rest. So for full agonists, the dose-response curves for receptor binding and each of the biological responses should be comparable. Now we're coming to the second type of agonists, which are the partial agonists. Now these have intrinsic activities that are greater than 0, but less than 1. And even if all receptors are occupied, the partial agonists cannot produce the same Emax as the full agonists. However, a partial agonist may have an affinity that is greater than or less than or equivalent to that of a full agonist. And when a receptor is exposed to both a partial agonist and a full agonist, well, the partial agonist may act as an antagonist for the full agonist. Agonist, antagonist, oh my god. Well, consider what would happen to the Emax of a receptor that is saturated with an agonist, and in the presence of increasing the concentration of a partial agonist. Now, as the number of receptors occupied by the partial agonist increases, the Emax will basically decrease until it reaches the Emax of the partial agonist. Now, this potential of partial agonists to act as both agonist and antagonist may be therapeutically utilized. Now, this is super confusing. Let me give you an example. Now, apiprazole is an atypical antipsychotic. It is a partial agonist at selected dopamine receptors, okay? And dopaminergic pathways that are overactive tend to be inhibited by apiprazole, while on the other hand, the pathways that are underactive are actually stimulated. Now, this might explain the ability of apiprazole to improve the symptoms of schizophrenia, with a small risk of causing extrapyramidal adverse effects. Okay, now the third type of agonists are the inverse agonists. Now, as the name suggests, they act inversely to the agonist. And how do they do that? Well, typically, unbound receptors are inactive, and they require the interaction with an agonist to assume an active conformation, right? However, some receptors show a spontaneous conversion from their inactive form to their active form in the absence of an agonist. What inverse agonists do is that they stabilize the inactive form of the receptor and cause the active receptor to convert to its inactive form. Now, this decreases the number of activated receptors to below of that observed in the absence of a drug. And so, inverse agonists have an intrinsic activity of less than 0. And they reverse the activity of the receptors and exert the opposite pharmacological effect of the agonists. Now, coming towards the villain of our story, which are the antagonists. Now, you already know that antagonists bind to a receptor with high affinity, but it possesses 0 intrinsic activity. But why is that so? Well, because they produce no response. Like I told you earlier, that the intrinsic activity correlates to the response produced by the ligand, right? And when there is no intrinsic activity, there's obviously no response. Now, an antagonist has no effect in the absence of an agonist, but it can decrease the effect of an agonist when present. Now, antagonism may occur either by blocking the drug's ability to bind to the receptor or by blocking its ability to activate the receptor. Now, basically, there are different types of antagonists that we're going to talk about today, and we're going to go over them one by one. And in the end, we're going to compare all of these with their respective properties. So first of all, we're going to talk about competitive antagonists. Well, what is a competitive antagonist? Well, it's already in its name. If both the antagonist and the agonist bind to the same site on the receptor in a reversible manner, they are said to be competitive with each other. Now, we can say it like it is plotting against our hero and prevents an antagonist from binding to its receptor and maintains the receptor in its inactive state. So as a result, no response will be seen. Just to give you an example, in the antihypertensive drug, which is taurursine, it competes with the endogenous ligand norepinephrine at alpha-1 adrenoceptors. Now, this decreases the vascular smooth muscle tone and reduces the blood pressure. Now, however, this inhibition can be overcome by increasing the concentration of the agonist relative to the antagonist. Now, in this situation, we can say that the hero is going to call his army and is going to gather backup and is going to win against the villain. So our agonist, if the concentration is increased, it will win against the competitive antagonist. Well, and so the competitive antagonists characteristically shift the agonist dose response curve to the right, which means that there is increased EC50 and without affecting the Emax. So earlier we were talking about competitive antagonists. Now, these are the type of antagonists which bind reversibly with the receptor. But what if the antagonist is not reversible? What if it's clingy and does not let go of the receptor? What happens in that case? Well, obviously, when it won't let go of the receptor, there would be no receptors left for our poor hero, which are the agonists, to bind. Now, if our agonist does not bind, and what will happen? No response will be seen. So these irreversible antagonists are very obviously cleverly called irreversible antagonists. And they usually bind covalently to the active site of the receptor. Now, since these antagonists are clingy and their effect cannot be reversed by increasing the agonist concentration like we observed in the case of competitive antagonists. And if we look at the dose response curve, an irreversible antagonist causes a downward shift of the Emax with no shift of the EC50 values, unless, of course, spare receptors are present. Now, coming towards another type of antagonists, which are the allosteric antagonists. Now, this type of antagonist actually binds to a different site, which is termed as the allosteric site on the receptor. Now, this is a site on the receptor other than the agonist binding site, and it prevents the receptor from being activated by the agonist, by our hero. Now, an allosteric antagonist also causes a downward shift of the Emax with no change in the EC50 value of an agonist. An example of an allosteric agonist is picrotoxin, which binds to the inside of the GABA-controlled chloride channels. When this picrotoxin is bound inside the channel, no chloride can pass through the channel, even when the receptor is fully activated by GABA. So, remember that these irreversible antagonists and allosteric antagonists are actually both considered non-competitive antagonists. Now, a fundamental difference, if you ask me, between competitive and non-competitive antagonists is that competitive antagonists reduce the agonist potency. That means that it increases the EC50 value. And non-competitive antagonists actually reduce the agonist efficacy. That is, they reduce the Emax. So competitive and non-competitive antagonists are actually the main types most books talk about. But there are also other types of antagonisms, and in that category, the first one we have is the functional antagonists. What happens in a functional antagonist? What are functional antagonists? Well, an antagonist may act at, now this type of antagonist may act at a completely separate receptor, and it initiates effects that are functionally opposite to those of the agonist. How fascinating, right? A classical example is the functional antagonism by epinephrine to histamine-induced bronchoconstriction. Now, histamine binds to H1 histamine receptors on bronchial smooth muscles, causing bronchoconstriction of the bronchial tree. And epinephrine is an agonist at beta-2 adrenoceptors on bronchial smooth muscles, which actually cause the muscles to relax. This functional antagonism is actually also known as physiological antagonism. And physiological antagonists are obviously two agents which have opposite effects that tend to cancel one another. Another example could be how prostacyclins and thromboxane A2 act in the case of platelet aggregation. Now, under this same other category, we also have chemical antagonists. Now, these chemical antagonists simply bind to the active drug and inactivate it. For example, protamine abolishes the anticoagulant effect of heparin. So this was a tale of our heroes and our villains, our agonists and our antagonists. And they didn't live happily ever after, because their battle is constantly going on within our bodies right now as well. I hope you have refreshed your concepts about the differences between agonists and antagonists, their types and their properties, and I hope you will use this video as a resource for future as well. So that was all for today. Keep watching sqadia.com for more such videos.